A very good evening, everyone, and welcome to another informative session that we have organized for today for all the parents. Um, Often, when we interact with parents, they mention about certain sign and symptoms of their child, which are like, child is laughing for no reason, smiling for no reason, they are in their own world, completely zoned out. They have fixation for certain objects like a rotating object, spinning object, the fan, wheels. They want to keep watching that. And at times they report certain symptoms, which are these symptoms can be like all of a sudden they'll just wake up at night and show such symptoms. So definitely all of these are stemming from some very deeper imbalances. Their body is just trying to say aloud what the deeper imbalances are. And often they are dismissed as just behavioral symptoms, which are tried to manage with behavioral therapies. Well, it may help, but we also have to understand that these are signs of deeper imbalances, and the gut brain connection is at play. That's what we will talk about today. We'll talk about the gut brain connection and how these symptoms are connected to some very deeper imbalances so that you also understand what's really going on, what may be really going on in your child's body. So with that, we will get started. Um, Towards the end, we will have a Q&A session where you can unmute yourself and ask. But during the session, I request all of you to be on mute. There will be a lot of important information that we will share. So, to make the best of this workshop, it's best that you keep aside whatever else you may be doing and focus on really grasping some insightful uh, points from today's workshop. With that, I invite Dr. Ashwani Garg to share his insights, his knowledge on this topic. Over to you, Dr. Garg.
Thank you, Dr. Rohit. Thank you, everyone. Good evening. Well, we all know autism is a complicated, complex problem. And there are multiple issues the child could be going through. Okay. Um, the microbiome is unwell, the diet is bad, the lifestyle is bad, immune system is bad, there are toxins, there are vaccine injuries, there are antibiotic injuries, there are screen overplay injuries. Eventually all of them are impacting the brain, and based on what all the play is, the child will have different problems. Now, can we fix many of these things? We can fix, and if we work with the child early on, there's a higher possibility. But unfortunately, this whole science is very complicated, the treatment is complicated, and sometimes parents get overwhelmed when we start a treatment. Things may not look right initially, which is usual part of the process. Parent become overwhelmed. Oh my God, I have to do so many things. For how long I can do these things? Okay. So with that approach, sometimes some parents start seeing some results, but because of the sustainability of the treatment, they may not be able to commit to it and continue with it. And unfortunately, they stop the treatment and they go to one doctor, another doctor. The circus going on, and unfortunately, parent may not be able to reach to the right goal and in respect to the child. And even the child is suffering, family is suffering. It's painful journey. Okay. Now, our intention for that is to give you as much as information, as much detailed information for your own understanding, which most of the medical world is still sort of unaware. That is also another part of the story, because a lot of time parents come to us, oh, my doctor has said this, nothing can be done. And we say something can be done, then the parent is confused. How come I have seen 10 development pediatricians, they say nothing can be done, and these guys saying something can be done? This is also another confusion to the parents, that they think maybe we're sitting far away, we're trying to extract money and all that. Now, our goal is to help the child, help the families. That is why one of the ways we're trying to do is to give you enough understanding of the problem. Now, it can be complicated, it can be overwhelming. Please sit through the session, try to grab as much as you can, and hopefully, some connections of understanding you will be able to build through it. Okay. Now, there are weird symptoms: laughing without a reason, talking to themselves, staring into the space, in their own world, lost in their own world, anxiety, agitation, fascination about spinning object things. Now, there are various puzzling symptoms and movements for a uh, parent and child also. Child is also unaware, and they're not doing it on a purpose. There's something going on in the body, but unfortunately, because we don't understand, child cannot tell what is going on with them. Everybody is confused. And most of the time, just because it is happening in an autistic child, we say it is an autism typical thing and nothing you can do about it. The child is referred to a behavioral therapist, and we are trying to force them to become act better. I am in pain. Because the pain, I'm crying, I have tantrums, but you keep telling me as a parent that no, calm down, calm down. But nobody's looking at my pain. Imagine a child is going through so much, and unfortunately, because we don't have the understanding of science in the medical system, we just keep, you know, pushing it down and then trying to correct through a behavioral thing, which can be a problem to the child as the child will grow. The question is, if some of these behaviors are not purely psychological, then where is it coming from? Okay, so this is what we want to explore today. What's the possibility? Okay, so brain does not work alone. This is another in medical world we have separated out all the organ systems. This is GI system, this is brain, this is immune system, and this is lung, this is kidney for kidney. There's another doctor for gut. There's another doctor for brain. There's another doctor. But in the real world, every system is talking to itself. You cannot fix the kidney without fixing the gut. You cannot fix the brain without fixing the gut, or vice versa. So, as medical practitioners, we need to develop that understanding how these things are connected. Okay, for a long time, doctors believed the brain was largely separate from the rest of the body. But today, with enough data, enough research papers, we have enough clarity that there is something called gut-brain axis. Gut and the brain are in constant two-way communication through a network of nerves, hormones, immune signals. And this connection, we call it a gut-brain axis. And through this axis, there's a, how gut is affecting the mood and behavior. Signals from the gut can directly influence the mood, sleep, attention, behavior, and how the child is receiving the world. The perception of the child also can be changed from the gut. The impact of the chemicals produced in the gut on the brain will change the perception of the child also. So much deep impact it has. It's a two-way street, bidirectional. Brain stress affects the gut health, and the gut imbalances send disruptive signal back to the brain. Both. If the child overall human has to function well, gut has to be good, brain also has to be good. And when we're trying to work on child with these problems, both systems we have to work on. We cannot just say, I will only do the gut work, I will not do the brain work, or I will only do the brain work, I will not do the gut work. It's a complicated problem, but this is important. As a parent, wherever you do the treatment, no problem. But whosoever is a practitioner should be looking at these fundamentals. This is the key thing for a parent to understand. Now, gut is like a chemical factory. There are trillions of bacteria, microbes in the gut. We call them a microbiome. These microbes are not just passive passengers. Okay, they actively produce chemicals that travel through the body, influence the nervous system. So these microbes will make certain chemicals and which will influence the functioning of other organs and also the brain neurotransmitters. So it's not just the digestion thing. It's a major contributor to the brain chemistry. Serotonin, 90% produced in the gut. Dopamine, gut microbes influence its precursors. GABA, modulated by the gut. Histamine, which is a major problem in autism, can also be triggered by the. So likewise, there are so many things that we understand, we don't understand as a science, but largely the fundamental point is being regulated from the gut. And gut is not an easy system to fix. A lot of nuances to it. We're still trying to figure out. Some things we have understood how to take care and all that, but still we are trying to figure out. But we just have to continue our work, and we keep learning, keep helping. But as a family, as a parent, this is where the crux of the matter. If something has to happen, right? Okay. So what happens when the microbiome is unbalanced, which means there are more unhealthy microbes, less of the healthy ones? We call it dysbiotic state. Now, the common triggers, first of all, what causes this dysbiosis? Antibiotic due to recurrent infections, poor diet, chronic inflammation, environmental toxins, and prolonged stress to the child. Of course, the screen time and all that can also be indirectly. A lot of EMF can cause that. Now, when this happens, this imbalance happens because of whatever has preceded to it, then the dysbiosis and unusual metabolites, chemicals will be produced by these microbes, which the healthy gut would not have. And these are neuroactive metabolites. They have a direct action on the brain. So what are the consequences on the brain? These chemicals can cross into the bloodstream, cross the blood-brain barrier, alter the brain processing sensory information, regulates the mood, controls the behavior. Okay. It regulates the sensory input. It regulates the mood and also controls the behavior. A lot of kids have a lot of sweet craving, sugar craving, car craving. It is not because the child is asking, it's a microbiome which is asking. Child has sensory issues because of the microbiome is not okay. A lot of the weird things, self-laughing that we just mentioned. I mean, some of these things we could list on the this thing, but as a family, you will understand the child is crying, child is hitting the head against the wall, biting others, biting themselves. So many painful things a child is going through, the family going through. But just because we don't understand nuanced information, what is causing that and what it takes to fix it. Well, one is knowing the problem, then one is fixing the problem. Both are tough. But then if we are willing to work on the path, there's so much opportunity to fix things around. Okay. Now, there are a few ways the gut is regulating the whole thing, and it is called neuroendocrine and immune regulating system. The communication happens through chemical signaling, serotonin, tryptophan, short chain fatty acid, toxins produced by the microbiome, which again modulate the brain function. Or the signaling can be through the vagus nerve. We call it neuronal signaling, which is a direct connection, which has an impact on the mood, cognition, arousal, and all that. And also it could be through immune system. Gut toxins will produce certain cytokines, trigger the mast cells, and eventually activate the microglia, which is driven by the poor gut microbiota, possibly thereby altering the sensory processing behavior cognition. The ways it is affecting the body, the immune system, the neural signaling, the chemical signaling, and they're altering the whole processing of the brain. Okay. Now, out of the many kind of the metabolites are produced for the today's context, which is child is having certain special behaviors, okay, which we think it's some autistic behaviors. Not it's a poor biology. It's a medical problem the child is going through. And one of the chemical that we will discuss something called tryptamine. So tryptophan usually comes from the diet, food, and it may convert into serotonin, which is a good thing. But when there is a dysbiosis in the gut, okay, the same tryptophan, instead of becoming converted into serotonin, start converting into tryptamine. Okay. And this tryptamine has a lot of impact on the brain. So it is a neuroactive compound that disrupts the perception, sensory processing, and behavior. And in sensory processing, a lot of the behaviors are just about sensory processing. We say there's a sensory load. What do we mean by that? What is causing that? Now, in the therapy world, there are a lot of fancy terms to describe certain things, but at the baseline, what is causing it? I may have a diagnosis. I may have a label to the problem, but how do I fix it? I need to know what is causing the problem. So many a times, a lot of the behaviors, out of them, the sensory processing issues are triggered by high amount of tryptamine because of the bad microbiome in the gut. The same tryptophan, which has to be converted into serotonin, start converting into tryptamine. And this leads to a ruckus in the body, in the brain. Okay. Now, which are the species, which is the imbalanced microbiome pathogenic species which can produce this tryptamine? Okay. It's Clostridium, different forms. It could be Klebsiella, it could be Pseudomonas, it could be Candida species also. There could be other species also. There could be parasitic infections also. But these are some of the key species known to make tryptamine from tryptophan. And tryptamine may convert into DMT and butyramine. Now, this is DMT is something, some people, they do some drugs. And because of some of the drugs has this precursors of DMT, and when the DMT increases in the brain, they have extra perceptions about life. They have out of body experiences. This is what DMT is. Similar things are happening to our child. Because of tryptamine converting into DMT or bufotenin, there's so much perception that is expounding into the brain. Child is just seeing the world very, very different than you and me. Okay. Now, these chemicals, they activate something called 5-H2A receptor or sigma 1 receptors, thereby sensory overload and dissociation. Child don't know what is me, what is outside, what is right, what is wrong. So much is happening in them. And we think these are some psychological behaviors, but some of these psychological behaviors are happening because of the biochemical imbalances, because certain microbes are being growing in their gut. So much is happening, unfortunately, So they could have altered perception, heightened sensitivity to light. They cannot look into light. They cannot hear certain sounds. They close their ears, things like that. The textures, certain time they cannot handle. It becomes overwhelming for them or sometimes fascinating also. Okay. Disrupted filtering of the sensory input. Brain may amplify or distort incoming signals, leading to overload or unusual fascinations. The way we see things, we think our child is also perceiving the same way. Maybe not, because the imbalance of the chemicals, what you look, when we look at certain things, it may be very different in their perception. And it also can lead to emotional regulation and poor regulation of the emotions also. Unstable emotion states, sudden agitation, mood swings that appears unprovoked. But of course, there's a biochemical mechanisms behind it. So sometimes we as families, as parents, as medical practitioners, we wonder why is this happening? Okay, now our job is to slowly, gradually try to find the science behind it. And so that we can come to some level of answers and some level of results and rectification to the problem. But because not many people are practicing this kind of science, as a family, as parents, it is becoming our important duty to understand these mechanisms. So we can help our own children, we can help other children also. Because if we don't really work on the right paths, child will suffer throughout. And these infections, these microbiome imbalances, without active interventions, they may not get fixed by its own self. That's a sad part of it. It really has to work hard. Now, same thing, because the microbiome is so much imbalanced, sometimes you will see when you give them fermented foods, you give your child um, kanji, you give your child ambali, which is a fermented millet, or curd, or vinegar, or pickles. These also will increase this tryptamine, histamine, trimine, things like that. And then you will see their behaviors have become worsened. Again, the same problem. Okay. The receptors, one of the receptors is 5H2A activation, right? And there's different kind of behaviors and sensory overload. And so if a child is reacting to fermented foods, the child is getting behaviors after a fermented food, think about that. Microbiome is bad, and the enzyme which breaks this tryptamines, which is called MAO-A, is also poorly functioning. So parents often report laughing spells, self-talk, hyper episodes appearing or worsening after fermented foods when we give them. So it is not because of some behavior, it is a biochemical imbalance that needs to be corrected. We have to solve that. We cannot let it be. And a lot of time, like I said, this event, this cascade of regression happens after multiple doses of antibiotics. Now we know for a fact that antibiotics, it will eradicate good microbiome. Whether infection goes away or not is another question, but it certainly impacts the healthy microbiome, especially the bifido bacterium is lost. Then there's more Clostridia infections will grow. And these yeast and Clostridia will produce more tryptamine, and we start seeing regression in our child, especially behavior. So antibiotics disrupt the balance between the protective and opportunities of bacteria. Clostridia overgrows, yeast blooms, oxalate will surge, MAO enzyme will inhibited, and driving higher tryptamine production, thereby behavioral issues. Okay. And a lot of parents report to us, while even in the treatment, sometimes they're in the treatment, things are getting a little better. Somehow child got a viral fever, they went to the doctor gave the antibiotic in viral fever, which I don't understand why they give antibiotics in a viral fever, which can be conservatively managed. And the regression happens. Such a sensitive topic that the whole medical system should be very, very careful about using antibiotics in kids. But unfortunately, nobody's bothered. If I'm a doctor, any parent come to me with the fever, I just do my job, give paracetamol, give antibiotic for 7 days, and rest of you deal with it. Unfortunately, this behavior is really impacting the families and the children. And 1 out of 30, right? The prevalence is increasing dramatically. And we cannot simply keep blaming the genes for it. Okay. It's the imbalances that we as a society has created in them. Okay. So when tryptamine pathway becomes overactive, brain receives a continuous stream of distorted biochemical signals, right? Thereby, this inappropriate laughing, sudden laughing in their own world, talking to self, talking to others, talking to nobodies, sensory fascinations, sudden agitation, difficulty falling asleep, staying asleep, dream-like dissociated states. They may not be present in the, they just may be having some out-of-body experiences also. We don't know. But people who take certain chemicals for some leisurely purposes, when the DMT is increased, they have out-of-body experiences. This we know from a fact from the adults, but same DMT is because the infection is increasing in these kids also. So point is, if there is something unusual, there must be an explanation to it. And I'm trying to bring your attention towards it. So Core signs: self-love, dreamlike state, self-talk, fascination about certain spinning things lights. Pupils are dilated. This is very typical. Beyond that, there could be vivid dreams, disturbing dreams, sleep talking, zoning out, emotional instability, agitation after fermented food. So these are some of the typical things. If they are there, think about tryptamine, think about Clostridia, think about fungal infections, think about some parasitic infections. Now, why it is being missed? Because it's too technical, it is latest information, and we really has to go beyond what is in the books that is taught to as medical doctors to us, and we really has to keep upgrading ourselves as medical practitioners, else we are lost. Well, most of us keep following what is in the regular system. It really has to come out of the basics and look beyond it when you really try to solve the problem. So I think this is, and if we test some of these things, you do organic acid test. In the organic acid, you will do high indole, you will see high arabinose, you will see high HPPA, you may see high oxalates, you may see B6, B2 deficiency. Okay, if we do microbiome test, we'll see Clostridia species, we see Klebsiella, Pseudomonas, Clostridia, some parasites, some protozoa, or absent bifidobacteria. Symptoms are there, markers are also there to corroborate. And more importantly, when you fix it, you will start seeing the difference in the behaviors also. But point is, difficult problem to find. Solution is also difficult. So as families, we really have to stick to the treatment for long enough time till it is settled down. Very crucial. Okay. The good news, so much can happen. Right food, right lifestyle, infection control, repairing the gut, restoration of the microbiome, and eventually you will see the sleep quality, duration, attention, focus, anxiety, behavioral calmness, all of that will get better little by little. It doesn't happen at one shot, taken months and years. But that is the thing as a family, we really need to understand the problem and understand. Now, one of the drug that is used in this autism spectrum, which is, sort of is called risperidone. Okay, the risperidone is nothing but a 5H2A receptor blocker. Okay, and you give risperidone, child behaviors will come down because the receptor which is excited by tryptamine is blocked, temporarily blocked. So it's okay to use risperidone or similar like a cyproheptadine or hydroxyzine, which is H1 blocker, or certain natural things like magnesium L-threonate or melatonin. It's okay to block these receptors through chemicals or natural biosimilar so the child can feel little more comfortable. But at the same time, it is important to figure out the problem and solve the problem also. This will give temporary relief to the family, to the child. Good thing, nothing wrong, absolutely good. But we still has to find what is going wrong in the body. So we have to reduce the tryptamine producing bacteria. So what is that we can do? We have to start using certain probiotic species. One of the probiotic species, Bifidobacterium. Only Bifidobacterium is a very potent species, can slowly reduce the tryptamine producing bacteria. We can use Clostridium butyricum, raises the butyrate and stabilizes the gut microbiome. We can also use Oxalobacter as a probiotic to reduce oxalates. And initially, we may have to avoid lactobacillus species. They may increase tryptamine. Okay. In this child, of course, diet lifestyle is very crucial. Gluten-free, dairy-free, sugar-free, things like that. Beyond, we also have to reduce fermented foods, cheese, vinegar, pickles, histamine-rich foods we have to avoid. We have to limit banana, pineapple, chocolate also. So detailing is very important. It's a very tough problem, but possibilities. Now, another thing is because the enzyme called MAO A is not optimally functioning, which is helping to clear this tryptamine. So we have to support the MAO enzyme with the riboflavin, which is B2, B6, magnesium if copper is low, and if the mitochondria is, support is required, we can do that also. Well, this is some one perspective to the problem. There's so many things we have to solve in an autistic child. There's one perspective to it out of the so many things. We can look at yeast infections. We can look at the yeast metabolites, which one of them is oxalates. We can test the metabolites, arabitol, uh, beta carbolines, and some of the drugs, nystatin, fluconazole, itraconazole, low oxalate diet, oxalobacter, things like that. And when you do this, you will see some difference also. When you continue doing it, you will keep finding more differences. Okay. So eventually, we have to restore the thalamic gating, which means it's a sensory input which is being distorted, which is being over amplified at the thalamus, has to be regulated. Okay. So again, theanine, glycine, taurine, some of the natural biosimilar compounds may be useful, or reduce the screen time, reduce the sensory input also. And sometimes some drugs may also be useful, but point is drugs are fine to give us symptomatic relief. At the end of the day, we really have to find the biological problem and fix that. So the key message, these behaviors in autism are not a matter of choice. They're often driven by biology, by metabolism, gut chemistry, and signals traveling from the gut to the brain. Okay. Rather than just trying to control the child through some, training them, let us try to understand the problem and let us try to fix their problem in the right way. Okay. And a lot of possibilities are there, especially in a younger child. When a child is young, problem is less, possibility of recovery is much, much, much more higher. So hope this gives a little more clarity to the parents, like what may be going on with them. Over to you, Dr. Lee.
Yes. Thank you. I hope parents, there were some new learnings for you, and with so much information around us, I hope you could grasp the most important ones that we wanted to share in today's session. So we will start. We will allow unmuting those who have question. You can either write in the chat or you can raise your hand. We will allow one by one to ask your question. Okay. Gaurav, you can unmute yourself and ask.
Hello, good evening.
Good evening.
Um, my child is 2 years 5 months old, and he has a problem that he likes spinning objects and he likes watching fan. So during winter time, this has reduced a lot. Again, when we have started switching on the fan, he's looking at the fan too much. His he has been put at the risk of autism, not diagnosed yet. Um, and we have been taking occupational therapy also, but what we really wanted to know, within 6 months, since 2 years, when he turned 2, we started taking his therapies. So we have seen lots of improvement in every aspect, including his language development also, but this problem has not subsided yet, and this is the only major concern we are facing right now. So we are just wondering that what exactly is the problem, why other things are getting improved, not this.
Well, madam, I think hope you got some clarity. There is a shift in the microbiome. Possibly certain infections could be there in the microbiome, which is inducing this whole cascade. Now, along with the therapy, like I mentioned, we had to really find the biological problem. Where is the medical issue there? shift balance the microbiome to a healthy one, and hopefully child is very young and there's every chance that he'll come out of it.
Okay, sir. I'll get back to your team for that.
Sure, ma'am.
Sir, one thing also, like he sleeps, his sleep pattern is like he gets up in every 3 hours. Still, he gets up in every 3 hours, demands for food. And we are giving him almond milk. Is it recommended to give him almond milk? Because
Don't
it is
don't
also
don't
produces
give
lots of oxalate.
correct, ma'am. Don't give almond milk, coconut milk, goat milk, camel milk.
A camel milk can be given because uh,
Camel milk is good, goat milk is good, coconut milk is good. No almond milk, please.
okay, but in Delhi, we won't get camel milk, fresh camel milk, so we can take the packaged one.
Good quality freeze dried package is fine.
Powdered form, you mean?
Yeah,
Correct. Freeze
there is a
dried, they call
brand
it good
which
quality.
has there is a brand called Advik. They have raw freeze dried powder. You can go for that.
Okay, thank you.
There's no
Thank you so much.
preservatives, hopefully, in that.
Okay, Harini, please go ahead. Okay, just before Harini asks her question, I'm also launching a poll. So parents, I request if you can also answer the poll. That will help our team to connect with those who may have certain questions after the workshop. Harini, please go ahead.
Yeah, thank you. So, my child is currently 6 years old. She is non-verbal and autistic. Uh, like, I am really concerned about her focus and attention. She's very hyperactive, and she just says very few babbling. Like, she does babbling and very few words. So, I'm concerned about how to increase her communication as well, speech and communication. And like I've heard about people doing detox, like to remove the toxins. So is there a protocol and how do I follow it? And I'm sure definitely she has some gut issues. She has constipation issues and frequent stomach aches. So, like I would definitely like to know about the process step by step, doctor, like how to go about the detox steps.
Right, right. So, Harini, for the simplicity, for parents to understand, okay. Now, child is non-verbal, you're saying, which means the capacity of the brain is limited, one problem. Second, whatever the capacity of the brain is, it's not fully functional. So one is a functional problem, one is a capacity problem, possibly. Now, first we have to reduce the issues which are causing functional problem to the brain. Means there are cells which can function pretty okay, but there are chemicals, there are toxins, there's inflammation, which is not allowing this brain to function the way it should be doing it. Okay. So it could be the toxins from the gut which need to be detoxified. It can be toxins like heavy metals, which can be causing a problem. It can be toxins in the form of the non-performing senescent cells, which could also be contributing to a problem. It could be unwanted immune complexes, which could be problem. So there could be various kinds of detoxes to be done. Okay, we need to relieve the constipation, we need to relieve the infections, we have to remove the endotoxins produced by these infections, we have to remove the plastics, microplastics, we have to remove the pesticide, we may have to sometimes remove some of the adjuvants from the vaccines, heavy metals. So it's a various kinds of detoxification processes we have to do, because early on a young child getting into a problem, it is a serious impact on the body. That's why they get into a problem. So we have to test the child in whatever best form we can do that, and accordingly, layer by layer, various processes from the nutrition side, from chelation side, from energy sides, various processes has to be done depending on the severity, depending on what is responding, not responding. uh, well, we run a program in case you can talk to our team also. You may get more details about it.
Thank you, doctor.
Okay. Gautam, please go ahead.
Hello, are you able to hear me?
Yes.
Yeah, my question is, in our unfortunate situations, if the child had to be given antipyretic and antibiotic because of viral fever for a couple of days, right? So once that is done, the fever, everything comes out, and then the child becomes a bit normal. How do we kind of do few changes in terms of nutrition, in terms of the supplements to get rid of the effects that had been caused by your antibiotics and antipyretics?
Mhm. Well, first of thing, Gautam, we have to understand antibiotics have no role into viral infections.
Yeah.
Okay.
Mm.
Viral infection most of the time are self-limiting problems. So let us try to avoid as much as when we find paracetamol to the minimal extent we have to use it, we use it. Hmm? Now, second is important strategies when antibiotics are going on. It is important, is duty of the doctor to give probiotics, especially Saccharomyces boulardii. It's the duty of the
Mhm.
doctor, but unfortunately, it's not happening. So, as a learned parents, we can start Saccharomyces boulardii.
Okay.
Well, beyond that, then how much is the damage? What is the problem? How much is the problem? We really have to assess that, and we may have to do few things or multiple things to recover, because these are not easy. Uh, you know, it's really child. It's a growing body. It's a growing mind, and microbiome is a key component which is participating in the whole growth of the body and functioning of the body. And then even a one round of antibiotic can really deplete things badly. It's pretty bad. Until unless it's something life threatening, we should try keeping away from the antibiotics.
Yep.
Okay, I hope, Gautam, that answers your question. Dr. Wafia?
Uh, Hi, it was a very insightful meeting. We got to know so many things. Uh, my child is 4 years old. He was diagnosed at around 2 years of age. I really wanted to know whether I can follow your program and get, maximum benefit from it because he has very weak immunity, and I have given him antibiotics a lot of times because I
Right,
was
right,
in a position to give. There was no other way. He was not getting better without. I tried avoiding antibiotics for a couple of days, but I was helpless and I had to give.
right, right.
So he has taken antibiotics a lot of times, every monthly once.
Yeah,
So his gut microbiome is very poor.
yeah.
So when I start your program at this age, how much of improvement can I expect, and what amount of timing will it require? Like, and can I get 100% recovery? I
Well,
just wanted to know that.
Dr. Wafia, mm, there are different ways to look at it. One way is, can I bring my child out of the spectrum, the label? Hmm? And
Yes.
after that, the capacity of the child can vary. Some may perform the anybody, in a smart zone. Some may be mediocre also, but ultimately they're out of the spectrum. Some may become closer of getting out of it. Okay, 4 is a good age, but you need to at least work for a year and a half, or 2 years. Depends on the severity. We don't know the severity today. If it's a mild problem, year and a half is every possibility. Or I would say 80% of the children out of when they're mild at the age of 4 or 3, 80% possibility they will come out of the spectrum. After 2 years, if you take your child to the developmental pediatrician, there's 80% chances that there's a drop of the diagnosis. That is possible. But then they still may be, they may become as sharp of their age or little this thing, but they're still out of the spectrum. But it's a constant effort for those years. We really has to do multiple things to make it happen. From the basics to lifestyle to diet to microbiome to mitochondria to immune system to thymus, peptides, brain peptides, or in some cases stem cells. Of course, stem cells now Supreme Court has said something, because sometimes people don't know the reality of the problem, and they can pass judgments about the future of people. This is such a severe problem that anything we can do to make a shift to the child's body is such an amazing tool that we practitioner families are made devoid of. Well, so much to be done, and if really willing, there's every possibility, every chance that it may happen.
Uh, okay, sir. Thank you, sir. One more question uh, regarding we are also taking other therapies with your program. So it's both the things together, gut and the brain therapies. So will it if one thing can one thing hamper other thing? Like if I'm working a lot of on brain, and the brain is improving, and if I'm supplementing him with your supplements, so will it cause a overreaction?
Well,
I
what are
just
you
wanted
doing? No, let's understand. If you're saying you're working on the brain, what are you doing in terms of actions?
Sir, actually, we got him occupational therapy over in my place, and we didn't see much improvement. His sleep was only getting worse. So we are seeing results with primitive reflex integration.
That you can do. That is no problem. Actually, what we will do is will enhance that integration.
Okay, sir. Okay. Okay, sir. All right,
Okay,
sir.
now another thing to understand, which is again for the the goodness of everybody, supplement basically means what is missing in the body have to be tested and be supplemented. Not some random things we are supplementing. If bifido is missing, we give bifidobacterium. If oxalate is more, fungal infections are more, we do antifungals and we do oxalobacter. If vitamin C is low, we do vitamin C. Phospholipids are low, we do vitamin phospholipids. So likewise, supplement means this body has certain needs and requirements to perform certain physiological processes, and we have to test and feed what is missing in the body so that they can perform better, recover faster, grow to the age, recover to the age.
Sir, one more thing, sir. My child is Plato G6 positive. Like I mean, it is assumed that his autism is because of these two genetic variants, which he got from myself and my husband. So, uh, how much of an improvement can I expect in genetic cases? Because if it happens
Well,
that if
I don't think there's any fixed that if this gene is there, child will have these problems. Now, let's say you as a doctor, you know the history that antibiotics were given. Now, genetics plus the environment will decide the phenotype, which is the outcome. We know the microbiome has gotten bad. Can we really work on the microbiome, trying better and trying to make the genetics of the child, what is the best outcome child can have? That can be tried. Okay.
yes, sir. Yeah. Thank you, sir.
Okay. Shilpa, please go ahead. Okay. Aparna, you are there?
Hello,
Yes. Who
this is
said
Shilpa on
hello?
behalf of yes,
Shilpa.
yes,
Okay. Yes.
yes.
Uh, should I wait? Is Shilpa speaking?
Yes. Yes. Yeah.
Okay, okay.
Hello, sir. Good afternoon. I would like to understand one thing. We are already in the third phase of the continuity plan. We have been going through like first phase, second phase, and we have gone through the scale up, and we are in the third phase of this continuity plan. The only significant thing we are looking at the moment is like he is still laughing, he is still smiling, he is still self-hitting himself. And we would like to understand when exactly it's going to come down. As exactly I've got to understand before the question before this one was like, you just told him like it will take 2 years time if he's in a mild autism phase. this here myself who is already taking this continuity plan is already into mild autism. This was the thing which was being confirmed from the therapy session that he's going through. So I am just like very much worried. Why is he still self-hitting himself? Why is he still laughing? Why is he not able to cope up with the or whatever the supplements that we've been providing him? Can you help me understand as to what can be done for this?
You saying your child is in third continuity, still some problems are there. Is what is Shilpa you're saying,
Yes.
right?
Third, in
Well,
the sense, we have done with first 6 months, and first basic 3 months has been completed, and first basic scalar has been completed.
right, right. Well, like see again, like I'm saying, ki sometimes this fixing the microbiome in some cases can take a little more time. Some cases
Okay.
they get faster, better. Some cases the infections are more tougher. It can take a little more time. Eventually, we'll get there.
Uh-huh. But I'm just trying to understand this. Why is he still self-hitting himself? That is the only concern. Why is he still laughing? After giving him a lot of treatment that have been already being planned according to the whatever the plan that you've been providing us. That is the only concern which we are really worried about.
Well, sir, that's what I'm trying to tell you that sometimes these infections are tougher. Even in
Okay.
the cleanup process, when we
Uh-huh.
clean this, we kill these infections, they release more toxins, and
Okay.
temporarily there can be more excitation to the receptors in the thalamus.
Okay. I'll give you
Okay.
a situation wherein during the scalar process and after the scalar process, there was a situation like one of his teachers was like praised him for the way he's been improving.
Mhm.
He has improved a lot at that point of time after the first continuity plan, and then he has dropped down again after getting into the second continuity plan. I don't know why exactly this uncertainty happened between us. We have
Some
been providing the same supplements that are being provided to us.
correct, correct, sir. That's correct, sir. Now there is something called biofilms. Okay.
Okay.
These infections make something called biofilms, and these biofilms could be sticking around the internally in the intestines
Okay.
or elsewhere also in the body. Okay.
Okay.
Now, slowly, gradually, as we start continue the cleanup process, there comes a time when we start breaking of these biofilms. Then
Okay.
also temporarily there could be more release of the toxins, and temporarily we may see a downfall.
Hmm.
As this cleans out, then child comes out better again.
Okay.
Okay,
That is
just to
what
give
I,
you,
I as you
yeah,
get to
just to
understand me, he was fine with this before the second continuity plan. Once we started the second continuity plan, he's again started self-hitting himself. He was pretty much better. That is what I would like to understand. Why is he coming down again back to the normal stage?
are you able to get what I'm saying, or is there any confusion there
Yes,
on?
of course, sir. But the thing
I
is, why is he in a very good phase and why is he getting into normal phase again?
Okay, you could understand what I told that some of the behaviors that you also mentioned, I also mentioned in the system, are because of certain toxins released by the microbiome. Are we clear on
Okay.
that?
Yes.
Now, as we start some deep cleaning in the body, we start breaking off these biofilms, start exposing these microorganisms which are hidden.
Hmm.
And when you kill them, their metabolites are released again.
Okay.
Okay, so as we continue the cleanup process, as load of the infection would come down,
Uh-huh.
hopefully this will, if everything is going as per the process, in between there's no break, there is no, you did not stop it and you did not, end up
Did
eating
not halt
something
it.
inside,
Yes.
things like that.
Yes.
If everything
Yes.
is as go, most likely we might be hitting the biofilms now.
Okay. Hmm. At some point of time, maybe in 6 months' time, he'll be fine. That's what is the
Yeah,
confirmation
yeah,
we would like to
yes, yes.
understand.
Well, sir,
Okay.
please understand, I
Of course, we
am
are trying to understand.
hopefully.
We were very much happy when he was fine, when he was getting to understand our rhythms. He is like 12 years as of now. He has started 10 years. And at 11 years of age, he was like pretty much understanding our whatever we are trying to explain him. And now 12 years again, he's become a child now. And now you need to understand whether he's a child or an adult kid. That's what we are like confused.
I get it. It's not that I am not.
So
I really
now
want.
that's the only concern is like whether in 6 months he's going to be coming back to the normal
He
stage
should, yeah. He
or
should. If he gotten better earlier, why not now?
okay, okay,
Uh, that is definitely you want to resolve that.
okay.
Hmm.
Obviously, we are looking for it. Thank you so much for this, man.
Okay. Aparna, you can ask now.
Yeah, hi. Like the previous person was saying, I have not taken any plan so far, but my son is 11 years old now. I just wanted to ask if it still works because I've heard doctors saying that younger the age, it's better. So since he's 11, he was diagnosed when he was 3, and we've been doing all the therapies, occupational therapy, speech therapy. He is verbal, he speaks, but there's a lot of irritability. Sometimes there's aggression, and then there is speech is also very little. I mean, it's there, but mostly it's need based, and other things are like one or two phrases. So I just wanted to understand. We wanted to do biomedical like 5 years back, and then we started, and then there were like a lot of supplements that were given. We kind of got overwhelmed, and then we just didn't go ahead with that. So I want to understand, will it help him? Will it, at this point of time, we can't miss school also if there are behaviors. So can you give me some clarity on that?
Well, Panna, let us understand. First hurdle, we cannot miss school because of the age. Is school so important than health?
It is not, but being at home, I think he'll get more overwhelmed and there will be
No.
like too much on our head also. So that is something that,
No. Well, I don't want to say anything about it, but you have to understand biology problem doesn't care about the school and you and me. It unfortunately is there, right?
right,
As the age is passing, the biology can bad also. The infections can increase, worsening
right.
can happen.
Yeah.
Lot
Mm,
of children, if you talk to parents, when they are 3 years, it's a mild problem. And we do a little bit of behavior, things like that, things are better off. As the age grows, problem grows, mild becomes moderate, that becomes worse at some point. Only 15% cases where this is spontaneous resolution, only 15% cases. Majority cases, this is worsening with the age.
right.
Hmm? So really,
Yes. Okay.
it's not easy. Please don't take me wrong. It's a tough journey for a family, and we have to do a lot of sacrifices. But wherever a child is, can we stabilize him? Can we reduce his behaviors? Can we reduce his aggressions? So whatever the capabilities that he has, we retain them as he grows, or we improve to some extent. Now, when the child is 3, the possibility of becoming autism free is much higher. Now, with the age, the capacities of the brain may not develop as much as at a younger age. But some of the
Right.
behaviors which are being caused by these microorganisms may get better.
Okay.
See, one is reducing the problem. One is improving capacity of the brain. Now, younger child, we can have both.
Right.
Older child,
Okay.
the capacity increase is limited.
Okay.
That may be the difference. And at a elder child, implementation also becomes more challenging because the young elder child has their own demands. Younger child,
Right.
you can do whatever you want to do.
Yeah, specifically with diet, I think it's a major challenge because now they know and they understand that if we restrict them,
Ah,
they don't take it so easily. I understand.
ah,
But I
correct.
wanted to
Not easy.
ask doctor, if there are like die-offs or something, those reactions, will it be higher for older kids or will it be the same irrespective of the age?
Well, no, it's not about the age, it's about the severity of the problem.
Okay.
If the severity is more, the die-off can be there. If severity is less of any age, die-off can be less also. But we
Okay.
try to
Okay.
always go slow as much as for the age. Well, but I cannot be 100% saying that it may not happen. We can try
Right.
putting all the possible actions to avoid that, but unfortunately, nature of the problem is such that.
Okay, but age is still okay, doctor. We can start, right? It's not like too late that we cannot do at this age. Is there something like
No,
that, or
let us understand again. When we are trying to solve autism, one of the key goal of a parent is my child's speech should get better, should get normal, comprehension should get better. Brain function, we want to make it better. That is the goal.
right?
Okay.
Yes,
Now,
yes,
because child is young, there is a spurt of growth anyways happening to the body and brain. Now, if I
yes,
remove the problem, I use the spurt of the growth with the age, brain will increase in size because naturally the body has to grow, brain has to increase in size. Okay,
right.
so
Hmm.
we have the strength to use the possibilities of nature. But at this age, we may be able to functionally increase the capacity of the brain functionally, but we may
Right.
not be able to increase the number of the cells.
Okay, okay, got it.
So,
Yeah.
in terms of the behaviors, in terms of the sleep issues, things like that, those things will get better drastically.
Okay, okay,
Capacity may increase to a limited extent.
got it, got it. Yes, yes.
That may be the major difference.
Yeah, but majorly we are worried about the behaviors because capacity, what is there? I mean, he's functioning well. I mean, at least not as bad as before. So majorly we want his behaviors to be better.
Okay.
So I think then it should help, right?
Yeah, yes, yes.
Okay, all right, doctor. Okay, okay. Thank you so much.
Okay, we'll now quickly wrap up. Ramya, you had raised your hand. Ramya, you are there? Okay. Madhu, you can ask your question.
Thank you, ma'am. Hi, sir. I just want to ask that for Nimit, we started FMT. It's been 24 sessions, and our continuity plan is also adjusted along with that.
Yeah.
So I just want to ask, um, like this trypto, sorry, I'm not able to use that word. Will this be in control after this treatment?
No,
Because
but hopefully the FMT treatment itself should help with that, no?
okay, so it will take care of it, right?
Hopefully, yes, yes.
Okay, yeah, okay, sir. And his behavior issues, he will be fine, like for a week, and we'll think, okay, his behaviors are getting better, and he's happy. But suddenly he will get agitation and aggressive. He will become.
Yeah.
And when I asked Dr. Chandra, he said it is because of colic pain or some inflammation in the gut or some die of something happening inside the body. So, can we, with our functional medicine, can we control that once in a while things with, can we give
Well,
any,
yes, some of the things like I mentioned, magnesium threonate,
mm,
taurine,
yeah,
um, glycine. Well, if we need, we can do these uh, amino acids to reduce some of the symptoms. Yes, possible.
magnesium threonate is already in his plan, so we
Ah,
can continue to give that,
correct,
right? It will
correct,
help.
correct.
And you
And
also
in
added
case
recently
short term, we have to use
SPFA.
some risperidone. Also, is possible. Use some risperidone on the days he's bad. For example, last week
Okay.
the eclipse and full moon was there. Then a lot of children got impacted by that. In those cases, probably a little bit of cetirizine, little bit of risperidone, things like that also will come in handy. We don't want the drugs to be continued for a long time, but then when situations are very volatile, we can use some of the drugs also to temporarily relieve them.
Sir, how about this short chain fatty acids are also given, butyrate. How does it help? How does it help the
Well, yes. So one of the possibilities help seal the leaky gut. Okay. Second is it improves the immune status. Third, it is also has an epigenetic impact of improve the brain health.
okay. Okay, sir. Thank you, sir.
Hmm.
All right, we'll take one last question. Shalini, you can ask. We'll keep it quick.
Yes, sir. Good evening, doctor.
Hi, Shalini.
How are you, sir?
I'm well. How are you?
We are well. I'm Avni's mother.
Yeah, yes.
So Avni is benefited a lot from the stem cell, and I wanted to update you. Like her reading has become very, very good
Right.
compared to what it was at the onset of the treatment. So that is one big milestone that we have achieved. So, but still there are challenges with her behavior and binging and all. So, doctor, I wanted to understand that there is a verdict on the Supreme Court for the stem cell. So, parents like us who have actually we can vouch and say that yes, it is helping our child. We want to go further. What is the guidance that we can get from you
Well,
for
let us
this?
get offline and see what can be happening. It's tough, but we can discuss and see, because it has become illegal at the moment, and there's a circular from the Ministry of Health also. Well, some of these policymakers may not understand the problem. We are the people living through the problem.
I understand, doctor, because I myself I have done law, so I know
Hmm.
how the law is passed and how it is implemented. We all know.
Yeah.
So there is a law that smoking in the public is a criminal offense,
Yes.
but that offense nobody even knows that it is an offense. Even I go to the parks and I tell parents, people
Yeah.
who are smoking when the children are around, that this is a criminal offense. So they take it very lightly. I said even you can be put behind the bars for it, but
Ah,
so that
exactly.
is the state of law in the country, that laws are just there.
Yes. No, fair point. Fair point. Let's discuss, shall we? Okay.
Okay.
I don't know what
Doctor,
we can do, but
another thing I wanted to ask you is like my daughter, she has hit puberty like couple of weeks back. So I want to understand that how will it affect her treatment? Will it slow down because now there are more hormones working?
well, I think only thing is we have to safely move her into the puberty, which means we have to keep a check on the hormones. And
Okay.
one of the problem of hormone disruption is happening through fungal infections. Okay.
Okay.
So I know our child is naughty and all that. We really has to try controlling our in food and sugars and carbs, so that her fungal infections are under control, so that her hormones are regulated, so that she don't get into other uh, problems of hormonal issues, things like that. Otherwise, it will not directly impact. In fact, some of the hormones may also help calm her down. For example, as progesterone gets better, sensory issues can get better, for example.
Okay.
Okay. But then hormones should play in the balance. This is important. A lot of time, fungal infections can increase estrogen. Estrogen can cause more havoc. But progesterone, which happens after ovulation, is more calming in nature. But then when more estrogen because of fungal infection, progesterone becomes less, then there's a havoc. But if there's a balance, then no problem.
Okay, you're saying that we have to be more careful now in terms of regulating her food.
Yes. Yes.
Okay. Okay. Doctor, can we give her like this, neem leaves to eat? Otherwise, is this fine?
It's fine. Neem is only
Or
sometimes
just
can prevent fertility and all that, but also for a young child is absolutely good for the microbiome. But any herb, we should do it for a short period of time, 6 weeks, and then take a break and restart.
otherwise, we can just give her lemon water every day.
Ah, that's
That'll do, right?
yeah.
Okay, doctor.
All right.
Okay.
Thank you.
Dr. Wafia, you still have a question?
Yes, ma'am. Just one
Make it a quick
question.
one, yes.
Yeah, thank you for allowing me. I have done a lot during his uh, fourth year, like when he was 3 years old till now. Now he's 4 year old. I've done a lot of things to him. Will all of that go to, vain if if I didn't start the gut program around 3 years of age? Like, will I not benefit from all the therapies I did for 1 year?
No,
Is
well,
gut program so crucial
no, well,
for
please
him?
understand. Okay, is like, let's think about this brain as a engine. If the fuel to the engine is not okay, which is coming from the gut, doesn't matter how much training I do, it's no good, right?
Yeah. Okay.
So it's more functional issue. Okay, so
Then this
neurons
has
can
to
be.
be, there has to be a lot more awareness regarding this program in our communities. A lot of people don't know about gut program. I recently got to know regarding gut health, and as soon as I got to know, I enrolled my child into your program, and I really hope that I see better results. Only the supplements are a little huge in number. I hope my child takes it really well. I recently enrolled into a program. He's I'm yet to receive the packages.
Right, right.
Uh, so yeah, I really, and one more thing, Doctor Sir, I wanted to ask. I see a lot of improvement in my child when I give antibiotics.
Ah,
Like, I really don't understand when
no.
and
See,
I don't
when
give him.
you
Yeah.
so when you give an antibiotic, you essentially reduce the microbial load temporarily. Now, microbial reduce load is reduced, the metabolites are reduced, temporary child is better. But when post antibiotics, the pathogenic will overgrow again. Then again, we get back to the problem. So we have to reduce the load of the microbes, healthy and bad, and then grow the healthy ones. That is the key.
Okay,
All right.
sir. Thanks a lot. Thank you.
All right. Ramya, you are there? If you're there, please unmute and ask, else we will wrap up. Okay.
Good evening, ma'am. Ramya here.
Okay, yes. Yeah.
I'm his husband. Ma'am, good evening. Thank you for your wonderful session. We came to know so many new things which we never heard. And my question is actually, my daughter is 4.5 years old and she's having so much of oral sensory issue, texture sensitivity. So, will any feeding therapy will help her? And
This is what exactly I told in this session, that one of the sensory issues from the textures also is because of it is coming from the microbiome. Okay.
okay,
Now, this is the core problem. Let's say, let us understand in a very, very simplistic way. It's good for every parent. I have pain. I have pain. Now, you as my parent don't understand where is the pain coming from. Then you try to convince me, no, no, it's okay. Just laugh out. Don't worry about it. Don't worry about it. Let me do something for you. Will it really help me, or I just can be, I can be diverted from my problem, but problem is still there.
yes, sir. Yeah, right, sir.
So that is something we have to really understand.
Sir, and one more question. As you said, to avoid fermented foods, like idli and dosa, they are also considered as fermented, and we have to avoid those things.
Well, sometimes, though idli dosa is a fermented cooked food, which is most
Yes, sir.
cases it's not a problem. In very, very few cases, because during fermentation, some histamine is produced. In very, very highly reactive cases, idli dosa can also be a problem. But majority, it is okay.
Sir, and one more question. This is there any test for this mitochondrial dysfunction which you will do from your side?
Yes.
And does photobiomodulation anything can help it? Like we recently have gone through this photobiomodulation thing, and we want to enroll for it also. So
Useful.
does it will
It
help,
is,
right, sir?
it is useful. Yes. Yes.
So, and recently we got this gut microbiome test kit. and we want to take the sample. In that, they mentioned 8 to 12 hours of fasting is required. And my daughter, she's having constipation, and we are not having any specific time for passing stool. So, in case it is in the daytime, we have to go, can't go for fasting.
Yes, no
Is
problem.
that okay?
It's fine then. See, when we don't have the right way to do it, what is the second best option? We can choose that.
Right, sir. So, can we give her broccoli sprouts powder?
Yeah.
It will help.
In some cases, it is useful. Some cases, it may be reactive. So try smaller doses and then see how much it is beneficial, and slowly increase the dose till she's able to handle that. But it's useful.
Thank you, sir. Thank you.
Okay.
So Varna, you are there?
Yes, I am there.
Yeah, please ask your question.
So, first of all, good evening to Dr. Sir. Sir, my son is 29 and I got recently enrolled in your program. I am fortunate, at least late, I have got enrolled. Okay, because I was not knowing because of your organization and your all these treatment plans. One of my friend told me, so I got enrolled, and we were there in Hyderabad. And we got my son treated with Dr. Praveen Saxena.
Yes.
Okay, he treated very well, and my son was out of this. So thinking that he is out, okay, and nothing much intervention would be required, we did not do anything. And he was good for almost 3 years, and slowly everything started turning. Okay. That time, majorly, my son was on CoQ10 supplement, amino acid supplements, digestive enzymes, and yes, nystatin one time it was given. So he was doing far better in schools, and everything was far better.
Right.
Now that we have come at this stage, and it is long, this was in 2006 or 7 it happened, and he started again regressions from 2010 onwards. We have been running from one door to one doctor to another doctor. We have not got any support, and neither we got your maybe not very fortunate to get your contact. But now that, sir, do you think what best I can do for my son? He has sleep issues and he has aggression also.
Right. Well, let us try our best. You are trying your best. Let me try my best, and hopefully we will be able to stabilize it. Most likely.
Sleep issues will go, sir.
Yeah. We have to make it go, no?
Yeah, we have to make, because it's 29, 90 kgs. It's I cannot, we cannot handle.
I know it's. May God bless all the parents.
Yes. Yeah. Thank you, sir.
Thank you, madam.
All right, one last question, Kalyani, you're there?
Hi, sir. This is Kalyani. Actually, my son is with the second continuity plan. Actually, when I was started with the basic plan, I saw the lot of improvements on my son, like speech and focus, attention, behavior also. Coming to the first continuity plan, I have not seen much improvement. After that, we have a Zoom call again. At that time, I spoken with you regarding this. Then again, Ankita gave me 1 month continuity plan. So based on that, few changes is few improvement I saw. Again, I started with the second continuity plan, and now he is like uh, touching others or hitting others or hitting himself, and not frequently, sometimes. And he used to tell that I'm touching that girl, like that. And coming to the attention and focus, is also less now compared to the basic plan.
Okay.
And
Well,
yeah.
Just do one thing, Kalyan. Just whatever the recent inputs, feedbacks are there, please write a message to Dr. Ankita. We'll discuss internally, and whatever else to be done, we'll do that.
Okay, sure.
Can I have the child name, Kalyani?
Pinakapani Prabhas.
Your husband just talked about the child, right?
No.
I think he did.
But anyways, just drop a line.
Kalyani? Are you Shilpa Kalyani?
No, it's a Kalyan.
Okay, all right. ठीक है. Just message us on the clinic number and we will look into it, okay?
Yeah, sure. Thank you, doctor.
Okay.
All righty then, everyone.
All right. Thank you everyone for being with us. And if you want our team to connect, either some of you may be connected with Anwar or Vijay, you can reach out to them. And we will probably have our next workshop in the upcoming days. So thank you so much. Thank you, Vijay and Anwar, for all your help. Thank you.
Thank you.